Imagine slowly becoming a different version of yourself without realizing why. Your energy changes, your mood changes, your interest in intimacy changes. And because it happens gradually, you assume it's stress, or age, or your relationship. But what if the real reason is sitting in your medicine cabinet? As a pharmacist, I've seen people blame themselves for side effects that were literally listed on the bottle the entire time. Today, we're breaking down the medications quietly affecting libido, arousal, performance, hormonal balance, and why almost nobody connects the dots. Let's start with one of the biggest offenders, antidepressants. Examples include sertraline, fluoxetine, escitalopram, paroxetine. These belong to a class called SSRIs, selective serotonin reuptake inhibitors. These medications work by increasing serotonin levels in the brain. Serotonin helps regulate mood, anxiety, emotional stability, which is why these medications help millions of people. But serotonin also interacts with dopamine and sexual response pathways, which means some people experience lower libido, delayed orgasm, emotional numbness, reduced arousal. And here's the dangerous part. People think, maybe I'm losing attraction. Maybe something's wrong with me. When in reality, their brain chemistry changed. Sexual side effects from antidepressants are extremely common. Some studies estimate rates as high as 40 to 70% depending on the medication, and many people never bring it up because they're embarrassed. So they suffer silently from a side effect they think is a personality change. Never stop antidepressants abruptly, but talk to your doctor or pharmacist. Sometimes, dosage adjustments, timing changes, or switching medications can significantly help. Now let's talk about one of the most emotionally sensitive medication side effects: blood pressure medications. These drugs are incredibly important. They reduce the risk of stroke, heart attack, kidney damage, heart failure. Millions of people rely on them every single day. These medications work by blocking beta-adrenergic receptors. In simpler terms, they reduce the effects of adrenaline on the body. That slows heart rate, blood pressure, physical stress responses. But for some people, that reduced stimulation response affects sexual performance too. Possible effects: erectile dysfunction, reduced arousal, lower stamina. And because this feels deeply personal, many people internalize it. Examples: hydrochlorothiazide, chlorthalidone, furosemide. These lower blood pressure by helping the body eliminate excess fluid and sodium. But changes in circulation volume can also contribute to fatigue, reduced energy, decreased performance. Examples: lisinopril, enalapril, losartan, valsartan. These medications relax blood vessels and improve blood flow dynamics. And interestingly, many people tolerate these better sexually compared to older blood pressure medications. This is why medication selection matters. Not all blood pressure drugs affect intimacy equally. What feels like a personal failure may actually be a medication effect. If side effects appear, don't panic, don't stop medications suddenly. Instead, discuss alternatives, dose adjustments, or timing changes with your healthcare provider. Here's one almost nobody talks about: antihistamines. Examples: diphenhydramine, chlorpheniramine, cetirizine. These are commonly used for allergies, colds, itching, sleep support. These medications reduce histamine activity. But histamine also influences moisture production throughout the body. So alongside dry eyes and dry mouth, some people also experience vaginal dryness, irritation, reduced comfort, decreased sexual enjoyment. And because people use these medications casually, they don't suspect them. You blame your body, when the issue may be temporary medication effects. This is especially common with older sedating antihistamines. Solutions include hydration, lubricants, discussing alternatives if symptoms persist. Hormonal contraceptives are some of the most commonly used medications in the world, and for many people, they work extremely well. They're used not only for pregnancy prevention, but also for acne, painful periods, endometriosis, heavy bleeding, cycle regulation. Because hormones influence mood, energy, emotional processing, libido, the effects vary dramatically between individuals. For some people, libido decreases, mood feels flatter, emotional sensitivity changes. You're not crazy. Your neurochemistry may simply be reacting differently. Track patterns, mood, libido, emotional changes, cycle changes. Because your experience matters clinically. Medication side effects are far more common than most people realize. And sexual side effects? People rarely talk about them honestly. But silence creates confusion, and confusion creates shame. So if something changed after starting a medication, pay attention. Your body may be trying to tell you something important. Which medication side effect surprised you the most? This video is for educational purposes only and should not replace medical advice, diagnosis, or treatment. Never stop prescription medications abruptly or make medication changes without speaking to your doctor or pharmacist.